50 or 60 set of skills which could be a mandatory skills for a nurse.
कौन से साल में आपने स्टार्ट किया सर इसे?
6th year is ongoing. So there have been lot of ups and downs. It's not easy to run 1,000 nurses who have been an active part of this Healthcare Skills Foundation.
अंत में क्वेश्चन सबसे बड़ा यही आता है कि फाइनेंसेस का क्या?
Actually, this is a little out of the box question.
नमस्कार दोस्तों, मैं आप सभी का स्वागत करूंगा हेल्थ केयर स्किल फाउंडेशन में एक बार फिर से। आप सभी को नए साल की हार्दिक शुभकामनाएं। 2026 is starting and at this very first day of the year we are starting our new upcoming series which is Healthcare Skill Foundation podcast series. And once again I would like to welcome our very own Dr. Anil sir. He is Healthcare Skill Foundation founder and president. Along with that, he is the HOD of Critical Care Medicine. Sir, would you like to say something about our podcast series?
I think first of all, सबको नववर्ष की हार्दिक शुभकामनाएं. And podcast is another beginning of our foundation. I think every small plant, once it grows up, it will definitely turns out to have lot of branches.
All right, sir.
So I feel this is one of the branch of the same foundation, and this is just to outreach a larger audience and larger people across the our country, so that we outreach a larger population. And this is just to bring what people feel about the challenges, the gaps, the way forward, क्या क्या solutions है problems के. And this beginning of the podcast, this is just the beginning of a podcast which we are sharing across. It will be definitely bringing a lot of senior nursing faculties across the national network. Lot of critical care emergency doctors, those who are actually dealing with the critical aspect of the management, and lot of way forward to share and uphold and also upbring, as well as to motivate lot of audience, lot of healthcare workers, because people with larger experience can actually bring so many changes to a larger world and to better healthcare understanding. So this is the idea, and there will be a lot of educational podcast as well in near future, which will be skill based, as well as the learning opportunity will be much more high. And to be very frank, we'll be adding a lot of common topics of interest, which we actually feel they are the actual core concepts or the core topics to improve the healthcare delivery.
So definitely, sir, as sir has mentioned, कि Healthcare Skill Foundation podcast series is going to impart again more knowledge into our healthcare team. But before moving ahead with this podcast idea and what you are going to bring to us, sir, from podcast, थोड़ा सा मैं आपसे जानना चाहूँगा कि हेल्थकेयर स्किल फाउंडेशन इन इटसेल्फ कहाँ से स्टार्ट हुआ, क्या आइडिया था, क्या इंसेप्शन पॉइंट था आपके लिए, क्यों स्टार्ट किया इस जर्नी को?
डॉक्टर सिद्धार्थ, एक्चुअली अगर हम देखें तो आई हैव बीन 25 years plus into this medical
industry,
education, hospital industry. Myself is also learning and still learning actually. So the idea came across when we have been working in intensive care, emergency areas, and we have been seeing lot of small gaps, which were, I personally feel they were related to the skills. They could have been related to the learning, understanding of the topic. And there is so much of documentation, so much of checklists, so much of things which a staff or a healthcare worker needs to undergo. So कहीं ना कहीं मुझे ऐसा लगता था कि they have been getting the education, but probably the skill set or the understanding of the concept is missing. And most of them are learning on job.
तो कोई तो एक गैप था जो आपको हमेशा,
मुझे यही लगा कि हमारा जो स्किल सेट्स है और अंडरस्टैंडिंग क्वेश्चन है और अंडरस्टैंडिंग के जो तरीके हैं, वो आई थिंक इट्स मोर ऑफ लर्निंग व्हाइल यू आर वर्किंग इन द एक्चुअल बैटलफील्ड. बट इन क्रिटिकल केयर एंड इमरजेंसी द बैटलफील्ड इज टू क्रिटिकल एंड यू आर finding a very narrow gap between the life and death.
So space of making errors become very less.
Yes, so that gave me an idea ki why not bring an program or an organization where we can focus more on skills enhancement, learning and understanding of the skills of healthcare delivery, because this is what we look at on a larger prospect, because there have been education, there have been certifications, there has been degree, but actual skill set, actual mindset, as well as the skills to perform bedside are little different as we look at. And this is what we have been seeing across, and even day to day we are still seeing there's a huge amount of gap between the knowledge and the skills application. You have certifications, you have degree, you have BSc nursing, MSc nursing, lot of qualifications, but the practical skills,
which actually at the bedside is important.
So that gave me an idea to create an organization where we focus only on skills, learning, courses, online. Online is also a new version which we initiated recently with our Healthcare Skills Academy, where we are also building up a lot of webinars, lot of academic content, and lot of academic and skill-based courses to enhance and outreach the larger part of the country, because everything cannot be offline. So online is also a medium, but it's not the only medium.
Online plus offline both is what the plan moving ahead.
That is what we have learned, and online plus offline, that makes it's a perfect combination, because ऑनलाइन में तो आप काफी चीजें सीख लेते हैं, बट एक्चुअल ऑफलाइन हैंड्स ऑन प्रैक्टिस, हैंड्स ऑन स्किल्स को देखना, करना, लॉट ऑफ थिंग्स व्हाट आर रिक्वायर्ड इन दैट स्किल्स प्रैक्टिस, सो दैट मेक्स यू मोर बेटर पर्सन.
कौन से साल में आपने स्टार्ट किया सर इसे, हेल्थ केयर स्किल फाउंडेशन को?
एक्चुअली हम काम तो काफी समय पहले से कर रहे थे. आई थिंक ऑफ लेट, इफ आई रिमेम्बर, वी हैव बीन डूइंग स्मॉल एजुकेशन प्रोग्राम्स, small skill based training programs, awareness workshops, lot of things we were doing, but कहीं ना कहीं we were against struggling with कि कोई एक certification body होनी चाहिए, या कोई एक संस्था होनी चाहिए which will be giving them some certification. So with that idea, we, after doing all this 10-15 years of work with different places, different hospitals, organizations, so we came up with the idea to bring Healthcare Skills Foundation into the reality. To bringing up this name was also a challenge. We Googled, we thought a lot of things, but as we already said, skills was the main aim. So we named it, and luckily the name was available to be as a copyright. So we named it as Healthcare Skills Foundation. And this we registered as a trust in Ghaziabad, and there were the 5 founder members. So those members also are from different specialty, from anesthesia, from general physician, orthopedics, public health. So a lot of people with different streams came up with the idea, and we initiated this journey of bringing this Healthcare Skills Foundation in September 2020. From there it began what we see 6 years of Healthcare Skills Foundation.
Okay. So September 2020 is the year in which you registered it, but इस के पहले भी इस एरिया में ऑलरेडी बहुत टाइम से काम कर रहे थे.
अगर हम कहें कोई भी चीज बीज और पौधा, तो हम काम तो बहुत कुछ कर रहे थे, लेकिन शुरुआत ऑफिशियली कह सकते हैं सितंबर 2020 से हुई.
और सर मतलब इतने साल की जर्नी में जो मतलब डेफिनेटली बिफोर 2020 आल्सो एंड आफ्टर 2020 आल्सो देयर मस्ट बी लॉट ऑफ अचीवमेंट्स और लॉट ऑफ लर्निंग्स व्हिच यू मस्ट हैव गेन इन द प्रोसेस, जो आप हमारे ऑडियंस के साथ शेयर करना
चाहें. अगर हम अगर देखें कि हमने लास्ट 5 साल जो हमारे कंप्लीट हुए हैं, 6th year is ongoing, so there have been lot of ups and down. मतलब it's not easy to run or continue with a vision which has got ups and downs. Like we build up an vision, and we have lot of things which are there as a part of mission and vision. But actually to uplift and to sustain everything on 5 years is definitely a big task. There have been challenges. There have been challenges in terms of funds. There have been challenges in terms of participation. There have been challenges in terms of resources. There have been challenges in terms of getting an adequate facility to create such programs. Collaborations is also a challenge. So there have been a lot of challenges in that 5 years of journey. We have conducted few workshops with very limited participation. So there have been challenges to sustain it for a longer duration of time. But over a period of time, I think organization, and with continuous support of its member and the supportive members, and this is a platform where I boldly say we have almost 100 doctors who have been a part of this foundation, and they all have been the life member of this Healthcare Skills Foundation. And they have a contribution, even a small financial contribution as a life member towards this initiative, which is also a very helping part to sustain such goals. There have been some pharma support in a very academic format, small academic support to some academic programs. We have more than 1,000 nurses who have been an active part of this Healthcare Skills Foundation, and very nominal charges as a lifelong member. For a healthcare worker, it is hardly 1,000 rupees. It is just a nominal fee, and we are very nominal in terms of actually charges for the registration.
So charges as in you are saying कि 1,000 रुपए में आप हेल्थकेयर स्किल फाउंडेशन के एक हेल्थकेयर की तरह से लाइफ टाइम मेंबर बन सकते हो, लाइफ टाइम जुड़ सकते हो.
It is something it is just like an association.
Okay.
So
to become a part of the foundation.
And becoming a member of this foundation gets you some benefit in terms of you can be a part of the academic developments. You can take support from all the members of the foundation. We have created a small training or a organization in Indirapuram, which is almost 2,000 square feet area with a good training hall which can accommodate 30 doctors or healthcare workers, 4 rooms where we can have small discussions, group discussions. We have most of the training mannequins available, not the high fidelity ones, but the
basic mannequins
as well as the medium fidelity mannequins are there to learn all the skills which are related to healthcare practices. There have been a lot of videos which we have been creating. So everyone has a contribution to make. There have been a lot of association with other organizations, but we are open for all such collaborations.
So just by giving 1,000 rupees and becoming a member, you can have access to the whole support system. You can access to organization for teaching sessions. You can use even ask the help from the teachers to help you out.
Obviously, we are open for getting more and more members to be a part of this foundation. Whatever academic content we have created, that can also be utilized by a member to teach and outreach their area of interest, their population, whichever part of country they are working in. So we are open for, because it's something which we are creating for larger audience. It is for community. It's something which we have gathered over a period of time. And this information, what we have gathered, is basically from working in the core areas of critical care or emergencies. And I boldly say that I must have learned most of these skills from technicians and the nurses, those who are spending more time bedside. Because their tuning of these skills and the experience matters a lot. Small things what we read in books and practical applications is little different. So I think it's way forward which we come across.
So सर, जैसा कि आपने बताया कि 5 साल से इस ऑर्गेनाइजेशन को रन करना, काफी ups and downs भी देखा सर ने. There are a lot of people whom we all are thankful to be a part of this organization. All those things are definitely said and done, but अंत में क्वेश्चन सबसे बड़ा यही आता है कि फाइनेंसेस का क्या, फाइनेंसेस कैसे रन होती हैं इस ऑर्गेनाइजेशन की?
एक्चुअली दिस इज लिटिल आउट ऑफ द बॉक्स क्वेश्चन, बट अगर हम फाइनेंसेस की बात करें, लाइक आई एम वर्किंग एज अ सीनियर कंसल्टेंट इन क्रिटिकल केयर इन डिपार्टमेंट in some organization. Right now I'm with Sharda University. Previously I was with Santosh, with Max, with Fortis. So my basic source of income is primarily from those critical care core jobs, where actually I have learned the skills of critical care and as well as that skills I want to give it to the community, which I feel which will be my major contribution towards the community for uplifting the healthcare delivery. फाइनेंस की बात करें, जैसे आपका क्वेश्चन ये था कि फाइनेंसेस कैसे मीट करते हैं, सो वी डू हैव आवर organization office which is owned by me, so there is no major cost burden to sustain that. There are expenses which we work and balance it through our founder trustees. We are actually spending some amount of money every month from our own sources, and we are actually thankful we are working somewhere and we are able to contribute to such developments. And near future we do expect bigger collaborations, bigger academic platform, more funding towards our initiatives. And I think everything always begins small, but if you sustain it, the answer would be on a larger perspective. And on a larger note, we would like to continue our spectrum of academic activities, skills-based program, workshops, fellowships, and lot much. Actually, we are open for all such collaborations with bigger organization, even national bodies we are open to, and even a lot of financial support if we can get it from corporate, from nursing colleges for academic upliftment or an academic collaboration, from various allied healthcare organization, institutes.
And are you open to do free collaborations too?
So there could be a lot of free collaborations, but there could be definitely an annual collaboration where there could be some financial support towards our initiative, because we are not a profit making organization as of now, and we aim to bridge the gap. It's not only the purpose is to make funds. I think the purpose is to reach a larger healthcare audience, and even if we take time, I really don't run short of time, but definitely time is a constraint because I've been working in a corporate critical care environment where there are job commitments, but at the same time I'm balancing it out to bring it for better enhancement, learning, and we are keeping on doing some or the other workshops, kuch na kuch chota program, kuch na kuch awareness drive, and I think healthcare staff is very close to my understanding, and I keep on learning small things while interacting with them, their challenges, and I think teaching them in the right way, accepting their mistakes, correct them, so that they become a better person for the subsequent years of their life and their healthcare delivery. So that is the main agenda which keeps me motivating. And again, the support and energy comes from the participation, the enthusiastic participation of nurses, technicians, allied students, doctors, and the support from all the doctors who are part of this foundation, all senior nurses from various government bodies, non-government bodies, corporates. I think they are the energy behind this foundation to grow large. And I personally see this vision to develop as a school of healthcare skills foundation. Probably this might take some time, but the vision what I look at in a larger perspective is to outreach a larger audience, to create a big academic content of skills, lot of skill-based programs, learning, education, collaboration. That is what I look at.
So, I mean, we are always being very thankful, and just after getting to know this thing, ki running this whole system on your own with the help, definitely the help of other team members also, but keeping it totally, non-profitable, but still going on and balancing your job at the same time and delivering such a good content to people to learn, that is something which is very commendable. And that is where we also learn a lot from seniors like you, sir, that how to not just learn for yourself, but try to give those knowledge back to the society too, because that is where the whole the journey of medicine grows, and how we can impart better healthcare system into our country. One more thing I would like to ask you over here, that कि और लोग अगर हमारी संस्था से जुड़ना चाहते हैं किसी भी फॉर्म में, स्टूडेंट के फॉर्म में या फिर टीचर्स के फॉर्म में या फिर फाउंडर्स के फॉर्म में, तो किस तरह से जुड़ सकते हैं?
Actually, we are very much open for collaborations. I think everybody can become a part or a member of our Healthcare Skills Foundation. We do have our website, www.healthcareskillsfoundation.com. We have our email, healthcareskillsfoundation@gmail.com. Our mobile numbers are easily available. People can easily contact with me on my mobile 98183849555. We are open for all such volunteers, those who want to become a member of our foundation, those who want to become academic support to our foundation. We are very much open for all types of such collaborations from all the nursing colleges, allied colleges. So that is, we look at, we have a YouTube channel, we have an Instagram page. We are bringing more and more content for audience and
in all the forms.
So I think we are very much open, and I think doctors can also be a part to become a life member of this foundation. And we'll be very much happy for all types of academic support, financial support. And we are also aiming for some collaborations from Skill India, or there are various skill-based organizations. There are national bodies from government, those who are working on skills enhancement. So we do expect some collaboration in time to come. And as we are building up the actual content, and we are also gearing up for a brighter future for skill enhancement or healthcare delivery. So with that aim and agenda, I think the motto is to continue and continue and continue till you achieve what we look at as a larger prospect.
So the larger prospect in itself is turning into such a place where all the skills can be taught at the same place, and with this motive that once they have been trained from our Healthcare Skill Foundation, they will not be worried at the bedside, and they will be delivering the best of the best skills without fear in critical and emergency environment where the time of management is very important for the patients.
So I think very rightly said. I think that fear will go once that staff is able to practice those skills, not at the actual real war front, but at the areas where we can simulate things, where we can create a skill-based scenario, where we can give them some monitoring sequence, we give them debriefing. So we actually nurture them. So I'll be more than happy if people after a period of time say this staff has been trained through our Healthcare Skills Foundation. So the skill set is definitely far much better. And that is the way forward that we look at.
And even for nurses themselves also, they will feel more confident.
The confidence level makes you a better person. The way you deal with your bedside, the way you document, the way you communicate, your grooming, your communication, your handovers, everything improves with such exercises.
So basically from nursing school, once you are out and if you are going and handling the patient, Healthcare Skill Foundation will make you at least this much confident कि आपका first जो भी attempt होगा वो already यहाँ पे हो चुका रहेगा.
Obviously, first attempt क्या I suspect, I assume it to be 5 attempts before actually on the real ground.
Real ground,
and
real
if
patient.
you believe me, there are at least 50 or 60 set of skills which could be a mandatory skills for a nurse to before start doing the bedside clinical practice. And the troubleshooting as well, because we never teach troubleshooting.
Exactly.
We teach on books, but we don't teach on the actual problems. So for that,
procedure करने के बाद कोई problem होता है तो क्या करना है?
So a staff getting a brief orientation in a environment where she feels comfortable not to lose patient, because on a mannequin we'll not be losing, but a staff gets to see what all things we are performing, what is the next step after this step. Over a period of 5 cycles of repetition, probably it gets registered to your mind, and the confidence level speaks out. A good confident nurse can have more pleasant time, less burnout, better financial standings, better long-term growth, better career potential. And I think it is the betterment of the healthcare worker per se. That is what I look at.
Look, I personally, in my own experiences too, I have noticed in my own bedside skills working that when I was in my early days, once I am given the opportunity to do something, and if I have done it ऑलरेडी ऑन अ मैनिकिन या कोई ट्रेनिंग एनवायरनमेंट में पहले हम वो चीज़ करके आ रहे हैं, तो पेशेंट पे हमें करने में भी काफ़ी कॉन्फिडेंस रहता है। और दूसरी चीज़ जो आपने बहुत अच्छी ऐड की, जो हमें भी शायद मिसिंग थी, कि करने के बाद कुछ प्रॉब्लम आ रहा है तो उसकी ट्रबल शूटिंग कैसे करनी है, उस सिचुएशन को कैसे हैंडल करना है, वो भी हम यहाँ पे सिखा रहे हैं लोगों को। सो थैंक्स अ लॉट सर फॉर गिविंग योर प्रीशियस टाइम टुडे टू इम्पार्ट सम नॉलेज एंड अंडरस्टैंडिंग टुवर्ड्स हेल्थ केयर स्किल फाउंडेशन। बिकॉज अक्सर मुझसे लोग यही पूछते हैं कि हेल्थ केयर स्किल फाउंडेशन में आप क्या करने की कोशिश कर रहे हैं और कहाँ से आपकी शुरुआत हुई। तो आई थिंक सो आफ्टर दिस फर्स्ट पॉडकास्ट everybody will be having a good idea about what we are planning ahead.
Yeah, definitely. And I think as we have discussed so much about it, in a nutshell, I will say it has to go in a larger way with more and more people supporting the statement or the mission and the vision of the foundation. And it's for the people and towards the people. It's something which we created, but we want more and more people to be affiliated and reach to a larger audience.
We don't want to keep it close.
If a person joins me and he's in Guwahati and we share the content, we share the program, and if we run in Guwahati, a person in Lucknow runs the program, person in Assam runs the program, person in Mizoram runs the program, or any other state or part of the country where we can outreach the skills, the academic program, the academic content. Probably that is the way forward what we look at. It should not be limited to me. It should be limited to the entire population towards the better skill learning and enhancement.
All right, sir. Thanks a lot. So I would request our audience to stay connected to us, as sir has already told that apart from online education, we are bringing you guys a new series, which is a podcast series of Healthcare Skill Foundation, जहाँ पे और भी speakers, stalwarts
Definitely. There will be very, very big stalwarts, and they are very big names in critical care, emergency. There are a lot of nursing principals and senior nursing faculties, administrators, medical directors, people from NABH background, people from NMC background.
So from their experiences we can learn a lot.
Yeah, people from nursing council, people from nursing schools, people from allied healthcare institutes, people from different universities will be a part of our subsequent podcast. I think we have to learn, what people have gathered over a period of 30-40 years of their clinical experience, because experience and sharing experience makes us more wise and gives us more level of motivations to a younger generation.
True, sir. Thank you, guys. Stay connected to our YouTube, and we would request you to subscribe to our YouTube channel, Instagram channel, and Facebook also.